Hello everybody, my name is Eugene from ABA Labs. Today, we're going to talk about frequency and consistency in early intervention programs and therapy sessions. If you're a parent thinking about starting therapy or early intervention for your child, this video is for you. One of the most common questions parents ask is this: how often should therapy be done for it to actually work? While there really isn't one answer that fits every child, there is one principle that remains the same across all effective early intervention programs: consistency. Consistency doesn't mean doing therapy every single day or pushing children beyond their limits. Instead, it means creating predictable and learning opportunities across time. In early intervention, consistency includes having a predictable structure during sessions, using similar teaching strategies, maintaining clear expectations, and aligning how therapists and parents respond to the child. For example, imagine a child who is learning how to request for something that they want, like a toy or like a snack. During therapy, the therapist consistently waits for the child to attempt the same response, such as pointing or using a simple word, before giving the item. At home, parents respond in the same way as the therapist. Instead of immediately giving the item, they wait and wait for the child to point or wait for the child to say before giving the item. Because the responses from adults and therapists stays the same, the child learns clearly on what works and communication becomes more intentional over time. Young children also learn through one-off successes. A child might follow an instruction correctly once during a session, and that's great, but it doesn't mean that the skill is mastered. Real life learning happens when a child can use the skill across different days, different people, and across different settings. For example, a child may follow a one-step instructions like sit or keep during therapy. Over the next few weeks, the same instruction is practiced repeatedly across play, at home, during daily routines, or with different adults. After enough repetition, the child begins to follow the instruction more consistently and with less prompting. The skill can become more natural and automatic rather than something that only happens in a structured therapy session. When intervention becomes inconsistent, learning can slow down. Children may experience mixed expectations, confused about how to respond, slower skill development, and difficulty generalizing skills beyond therapy. A common example is tolerating the word no. Some days when a child becomes upset after hearing no, adults may give in to avoid a meltdown. Other days, expectation changes and no means no. From the child's perspective, the rules feels unpredictable and they don't really know when no really means no. An emotional reaction may vary. They may cry, they may not cry. This doesn't mean that caregivers are doing anything wrong. Life happens and it does help explain why progress can sometimes feel uneven. It is also important for us to remember that therapy sessions are only a small part of a child's week. What happens outside the session plays a big role in how quickly and effective skills develop. So let's say a child is learning to wait. The same strategies might be used during therapy, at home, during daily routines, during playtime. When the approach stays the same across different environments, waiting can become a life skill and not just a therapy skill. When parents and therapists work together using aligned strategies, children receive the same learning messages throughout their day, which strongly supports generalization and long-term progress. At ABA Labs, consistency is built intentionally into every intervention plan. This includes structured program planning, clear goals that guide each session, collaboration between therapists and parents, providing therapy that supports real-life learning. By working in a child's natural environment, we can support consistency not only during sessions, but also across during daily routines and during family interactions. So lastly, how often should early intervention be done? There is still no one universal numbers that works for every child. The right frequency depends on the child's current needs, learning readiness, family routines, and what can be sustained over time. Consistency is often far more important than intensity. A realistic schedule that can be maintained usually leads to better outcome than an intensive plan that cannot be sustained. Alright, I hope this video helped you better understand your child's therapy and early intervention needs. If you find this video helpful, do like, share, subscribe, and leave a comment down below to let me know what topic you like me to talk about next. With more parents, we can build a supportive community to help all children grow and thrive together. I see you in the next video. Bye bye.